Alright, hello everyone, my name is Alyssa Wright, and today I'm going to be explaining to you what lymphoma is, how it affects the body, and how it can be treated with the modern medical technology available today. So let's jump right into the slide. I'm really excited to talk to y'all about this topic. Alright, so why is lymphoma important to me? Before I begin, I just want to give a short backstory on why I chose this topic and why this topic holds so much significance to me. About 12 years ago, my Uncle Thomas, who's pictured here, was diagnosed with non-Hodgkin's lymphoma. He lived with his illness for about 3 years before it did end his life. Uncle Thomas was an incredible man who did everything for the glory and the honor of God, and he loved his family deeply. So that's just a short little backstory as to why I chose this topic and just why it is important to me. Alright, so let's jump right into the presentation. Right, so here we have a diagram of the lymphatic system. The lymphatic system is composed of multiple different parts with different functions, some of which can be seen in this diagram. Some that I'm going to mention aren't shown in this diagram, but that's okay. So first off, let's start with bone marrow. Bone marrow has a vital job of making white blood cells, red blood cells, and platelets. So bone marrow has a really important role in the lymphatic system. Next, we're going to talk about the thymus. The thymus can be seen in this image. You can see it right in the middle of the throat. Right in the middle of the throat, right here. We have the thymus. Perfect. Okay. So the thymus is an organ located in the upper part of your chest. It is here that T cells fully mature. T cells help your body fight off invaders. So it's really important. The thymus has a really important function. Next thing I want to talk about is lymph nodes. You can see lymph nodes right here in the neck, but lymph nodes are not only located in the neck, they are scattered throughout your body. They're highly concentrated in the armpits as well as the groin area, as well as the neck and behind the ears, but they are all throughout your body. So lymph nodes are bean-shaped glands that monitor and cleanse lymph as it filters through them. They clear out damaged cells and cancer cells. They also store lymphocytes and other immune system cells that fight harmful substances. Alright, so next is the spleen. The spleen is this little bean-shaped guy right here. This is the largest lymphatic organ and is located on the left side of the body under the ribs. The spleen filters out blood and removes cells that are old or not functioning correctly. Next thing, which is not pictured on this diagram, but that's okay, is the mucosa-associated lymphoid tissue, also known as MALT. This is a mucous membrane that exists throughout your body and lines areas such as tonsils, airways, small intestines, and more. MALT has the important job of looking for and destroying potentially harmful germ cells. So that is a really important aspect. The next thing I want to talk about is lymphatic fluid, which is also known as lymph. Lymph has the important job of transferring infection-fighting white blood cells, also known as lymphocytes, which we're going to talk about more as we get into what lymphoma is and how it affects the body. Another really important part of the lymphatic system is the lymphatic vessels, which we're also going to talk about more. So these are tubes that go all throughout your body, forming a complex network. These tubes pass lymph throughout the body constantly. Right, and then next, which you can see here, is collecting ducts. So right here we have the collecting ducts pointing right here. There are two main ducts in the upper part of your chest that empty lymph into the subclavian veins. These are emerging points where lymph rejoins the bloodstream. So those are really important. And then the last thing I want to mention are tonsils and adenoids. These trap pathogens in food that is eaten or air that is taken in. So this is like the first level of protection that your body has in attacking pathogens. Alright, so let's jump on over to the next slide. So this picture here I wanted to put in because it just shows how complex the lymphatic system is. You can see the green lines going all throughout the body in this image. That are the lymphatic vessels, which we talked about. which, as mentioned, pass lymph throughout the body. You can also see in this image the little green dots, which we talked about. Those are the lymph nodes, and I know in the picture you saw them in the neck back here, but as you can see here, they are all throughout the body, concentrated definitely in the armpits and groin area as well as the neck, but they're all throughout the body. The human body actually has close to 600 lymph nodes, which are necessary when fighting off infection. All right. So, lymphoma in general is a broad term that refers to cancer that begins in the cells of the lymph system. There are two types of lymphomas, so first we're going to talk about Hodgkin's lymphoma. Hodgkin lymphoma starts in B cells and contains Reed-Sternberg cells. When these cells are present, Hodgkin's lymphoma can be diagnosed. As you can see in this image to the right, it's a picture of just normal cells. And the left image shows the Reed-Sternberg cell, which has been produced. Hodgkin's lymphoma is less common than non-Hodgkin's lymphoma, but it is more curable. All right, so what is non-Hodgkin lymphoma? Non-Hodgkin lymphoma begins when a type of white blood cell called a T or B cell becomes abnormal. The cell then divides again and again, making more abnormal cells. Unfortunately, for most people with non-Hodgkin lymphoma, it is often found too late in the stage. It's often found later in stages, making it difficult to treat. Non-Hodgkin lymphoma is grouped into one of two grades. First is the high grade, meaning it is faster growing, and second is the low grade, meaning its progression is slower. All right, so here we have some of the symptoms of lymphoma. So some symptoms of lymphoma include tiredness, unexplained weight loss, fever, soaking night sweats, coughing, trouble breathing, weakness, pain, swelling in the abdomen, swollen lymph nodes, which can be seen in this bottom left picture right here. Just to explain this a little deeper, they are not always visible, but in this image, they are. And then also what is known as a lymphoma rash, which can be seen in the top right image right here. All right, so there's different types of treatment options for people with lymphoma, including chemotherapy, radiation, as well as targeted therapy, which uses drugs or other substances to attack cancer cells, and immune system therapy, which boosts your body's own ability to fight off cancer. Here's a list of sources I used when making this presentation. I appreciate your time. Thank you.